Thank you very much, Mr. Betts, and it's a great pleasure to follow the honourable gentleman. And can I add my congratulations to the honourable member for Rutherglen and Hamilton West for securing this debate. And it's a pleasure to also listen to the chair of the APPG. And I'm very grateful for the input that he gave from Wales in particular, because I think it's very interesting to hear how different administrations who have responsibility for health are tackling this issue. I want to really spend the brief time I have talking about issues in the northwest of England. And I think perhaps, like my honourable friend for Totnes, this isn't an area that I was particularly familiar with until I became a member of this House and heard from constituents, in particular their families, who had seen loved ones go through the terrible, very fast results of hearing about liver disease and sadly passing away. And I'm particularly grateful to Dr. Tim Cross, a constituent who's also a consultant hepatologist at the Royal Liverpool and Broad Green University Hospital Trust. Talking to him, he's really helped me to understand some of the issues, and in particular some of the regional disparities affecting not only constituents in Warrington, but also in towns and cities like Blackpool and Manchester and Liverpool, major centres in the northwest of England, which I think are woefully underserved in terms of transplant facilities for tackling liver disease and liver cancer. All of those aforementioned areas of the northwest record some of the highest rates of liver disease mortality, with the most recent statistics highlighted by the British Liver Trust from 2020 showing a shocking 1,838 deaths, the highest of any region in England. Per 100,000 people, that equates to 28.4 deaths. By comparison with an area like the east of England, almost half that figure recorded, 16.1 deaths per 100,000. And over the course of 2021, the Northwest saw around 10,000 admissions to hospital due to liver disease. Again, by far the highest figure in the country. Now, we know, as honourable members have said, the key to early diagnosis is really fundamental in treating this disease and preventing premature deaths. But the critical issue for the northwest of England is the total lack of liver transplant facilities in the northwest of England. There isn't a unit that does it. Patients are routinely travelling to Birmingham, to Leeds, and further afield to be assessed for liver transplant. That's no service for an area covering 7.3 million people, major cities like Manchester and Liverpool. And it's very clear to me that one of the reasons that we have such high levels of liver disease is the poor facilities in these cities in the northwest of England. My constituents are also disadvantaged because they're having to spend a lot of their own money travelling to these centres to be able to get a clinical guidance in a way that other areas are not having to do that. And that toll is really taken on those constituents who face these challenges. In Warrington alone, 51 lives were lost due to liver disease last year, and our town's diagnosis, hospital admissions and premature deaths far exceed the national average. And when we talk about the need to level up areas of the UK, particularly in the north of England, that isn't just about economic growth. Regional inequalities in healthcare really do need to be addressed. And I'm very pleased that this government is seeing that as a priority and tackling it. But one area that it could really address this is in looking at liver disease and liver cancer in particular. So I do welcome the government's commitment to narrow the gap in healthy life expectancy. But I think, I urge the Minister to look at this area in particular and to see what we can do. I know she will be aware that there are areas of the UK asking for better healthcare and better hospitals. Warrington is one of those areas bidding for funding to secure a new hospital. And I would say to the Minister, Warrington would be a great place to have regional transplant facilities for the northwest of England. A new facility could accommodate that. And I'd be very keen to hear her thoughts on the additional capacity that could be released in the northwest of England to try and help those people that are suffering from this terrible disease in my region. Thank you very much.